Hello, everyone, and welcome to our afternoon session on day 4 for our nonprofit day of 24 Hours of Rare. We are privileged to have Dina Matos with us, who is the Executive Director of the CARES Foundation. Dina, thank you for joining us. You're going to be talking about an incredible topic today called preserving patient rights and to all treatment options and patient rights to making medical decisions for their children. And I can tell you that this is a hot topic in our house because our chronically ill little one turned 12 years old last week, and policy seems to be sometimes from place to place, but we had to get special access to her medical records since she turned 12. So there are a lot of changes afoot and how we take care of our children, because 12 is a pretty young age to start managing your own healthcare records and stuff. So I'm going to turn this over to you and let you talk and get off my soapbox. Dina, thank you and welcome.
It's my pleasure, Jeff. Thank you. Thanks to you and Eden for giving me this opportunity. I really wanted this to be a conversation, so we'll leave a lot of time for questions and answers. So this topic is something I've been working on for quite a while, very near and dear to me. As Jeff indicated, Executive Director of CARES Foundation, and we are the only U.S. organization solely dedicated to supporting patients with a rare genetic disorder called congenital adrenal hyperplasia, or CAH. We represent more than 8,000 patients and families across the US and across the globe, about 70 countries where we have patients and families from. Although we are a US organization, US based, we do support patients, with their needs across the globe with support group meetings, referrals, and so forth. So just a little bit about CAA. Genetic disorder. It's a form of adrenal insufficiency, which inhibits the body's ability to produce cortisol, the stress hormone, a hormone that's essential for life. CAH can also produce excess androgens, which may result in females with the most severe form of CAH called salt wasting CAH to be born with atypical genitalia, or genitalia that um, appears different than the norm. And I'll talk about the norm a little bit. So basically, they're external genitalia because they're exposed in utero to excess androgens, may appear male, but they are genetically females with all the internal organs of a female. Now, depending on the severity of those differences in the atypical genitalia, they may or may not require surgery. Sometimes the urethra is fused, so they're not able to urinate, like other women whose genitalia is intact. So sometimes that requires surgery, which we call female genital restoration surgery, to ensure that the body functions the way it should. Now, these surgeries have become very controversial. For several years now, there are anti-surgery advocates, activists, who have been calling these surgeries genital mutilation, which is insane. That's not what it is. They've called it sex assignment surgery or cosmetic surgery. And they use these terms because they know they're, hot button issues and they can get the attention of the media or politicians. So they've been at this for a long time. Excuse me, my allergies. And they continue to push for legislation that will ban these surgeries. Now, before they attempted legislation, they were going after institutions and continue to do that, and doctors, going as far as threatening doctors' lives, similar to the anti-abortionists. So it doesn't matter what side of the political spectrum you are, but this is what we compare these activists to. So they're continuing to advocate for legislation. We have been able, with the help of parents and patients, been able to defeat some of these bills, particularly in California. There were two bill, well, a resolution and a bill, but these bills keep coming up. So just this morning, I've been spending the entire morning working on a bill that's going to be heard in Connecticut on Monday. But currently this year, during this legislative session, there are already two bills that have been introduced, one in California and one in Connecticut. Now, these activists want politicians to ban surgery. They don't want surgery to be available to these patients. They want the patients to make the decisions on their own. So basically, they want to wait until the child is old enough to make a decision. Now, the California bill gives a specific age, which is age 6. And then Jeff, you just talked about, at age 12, that you don't think your child is able to, access records and be involved in those decisions. So that's not an ideal age. The other issue with this particular surgery for CH children is that the recommended age where, there are the best outcomes is between 6 months and a year of age, sometimes up to 2 years. Obviously, patients are not able to make their own decisions. Therefore, parents are making these decisions for them, with their medical team. And in our opinion, that's the right course of action. We're not pro or anti-surgery. The activists say that we are pushing surgery for all patients. Absolutely not, because any surgery, and especially those for patients with CAH, whose body doesn't function the way other bodies work. So the absence of cortisol, which has to be replaced with daily medication or they will die, is a risk. Any surgery is a risk, because of, the possibility of, infections or problems with anesthesia, because their body doesn't respond to stress or illness the way a regular body is. So anything that is different, any illness, even, the flu, common cold, a virus, can affect these patients differently and can put them at risk of an adrenal crisis, which could be fatal. So, these parents are not going to subject their children to unnecessary surgeries. So we are not pro or anti-surgery, but we are advocating for patients to have access to all treatment options. We feel very strongly that all treatment options should be available to patients, and that parents should be able to make that medical decisions for their children, not politicians. And this has implications not only for CAH, but for all pediatric care. So if this movement is successful, there can be implications for all sorts of pediatric care decisions that parents are or are not able to make for their children. They can, if they ban these surgeries and tell parents that, no, you don't have the right to make these decisions for your child until your child is old enough, that can have implications for, cardiac surgery, for transplants, they've even these group of activists even say that, cleft palate should not be addressed. It should be left, for children to make decisions for themselves, or that, they've also said that you're born the way you're born, and parents and doctors don't have the right to change that. So if we go down that route of banning, medical procedures, and making sure that, patients don't have all treatment options, that's a very slippery slope. We're also working with, a group that is working on gene therapy for CH, for instance, and gene therapy is available for other, other diseases and disorders. And they're even concerned that these bills are going to have implications for what they're doing. So, if they're saying, well, you don't have the right, your parents don't have the right to make any medical decisions for their children, then, something like gene therapy, which could potentially be a cure for CH and so many other disorders, can also, be at risk here. So, our position again is that all treatment options should be afforded to these patients, and that parents should preserve the right to continue to make medical decisions for their children with advice from a medical team. My argument is always, parents make decisions for their children from the moment they're born, or arguably even before they're born. If a mom decides that she's going to smoke and drink during pregnancy, that's going to have an impact on the child. Once the child is born, the way you feed them, the way you take care of them, do you change their diaper, when they're wet or soiled, or, do you wait 12 hours to change the child's diaper and then they develop a rash? Do you feed them adequately? So from the moment the child is born, or even before the child is born, a parent is making is making decisions for those children. Something as important as medical care should absolutely be the right of parents. We feel very strongly that politicians should not be involved in medical decisions. The decision should be left to parents and doctors. And of course, patients if they're old enough. But these are not decisions that should be dictated by legislators, by legislation, by politicians. They're not medical professionals. There are lots of, intricacies and, a surgery and this has implications again for other surgeries and other procedures, but a surgery like the surgery for CH is very complex. And there are only a handful of doctors who truly have the expertise to do this surgery. So I just wanted to give everyone a little bit of a background and why we feel so strongly that treatment options should be retained, and that parents have the right to make medical decisions for their children. And if legislation for something like this is successful, it can have implications for all sorts of medical care and other decisions that parents make for children. So does anyone have any questions? I'm opening it up to everyone.
Hi, Dina. Actually, there are a couple of questions that have come in, and I know, like Cambria has secondary adrenal insufficiency. She's a panhypopit kiddo with secondary adrenal insufficiency. So some of the things you talked about can definitely relate to. I know that some of the challenges that we have had in her as parents in getting better is ERs. So you bring in this kid, they look normal.
Right.
With it, trying to get those ER staff to understand the urgency. We have actually had Cambria collapse in the ER waiting room, and they're like, "What's wrong with her?" I said, "We've been telling you what's wrong." What kind of recommendations? I mean, I know what we have done personally, but the stories out there are, some of them are kind of horrific, but they are, in that I had to give my child an emergency injection, and then security removed me from the hospital because I gave them an injection that saved their life, which is just, ridiculous. So what do you recommend?
Jeff, they look fine. They look okay. So, if a female requires surgery and, she's getting infections because, she doesn't have an opening like everybody else, she looks okay unless, she gets an infection and gets sick. You're talking about the ER. I can't tell you how many times I have threatened ER doctors I've had to call administration. I have sent threatening letters to police departments, EMS, you name it. Again, because they don't understand, they need education. These patients look okay. All right, so they go to the ER. For instance, if Cambria, breaks a leg, her body's not going to respond the same way that another child's body is. So she needs special attention. She needs that injection. And, EMS is a whole different issue there until we started advocating for protocols for EMS so that ambulances carry, this life-saving medication, the injection, and, that they're trained to administer the medication. Um, until, we started advocating for that and I went to Washington, I didn't know that EMS, which is such an important service, there is no federal oversight for it, which is outrageous in my opinion. So everybody's left to do what they want. We've been successful in getting protocols adopted at the state level, but then every state has their individual region and it's a nightmare. And sometimes, we're successful in getting protocols adopted one year, then they change the protocols the following year when they evaluate. And, people don't even know that they don't exist anymore. So education is key. We tell parents, whether it's school or ER, before a child goes in, or, alert them that your child has a medical condition that is life threatening. So this is what needs to happen in an emergency. For instance, in a hospital, if you have the opportunity and the hospital is open to it, and I worked in hospitals for a long time, 17 years. So, sometimes there are opportunities for someone to come in and perhaps it's your endocrinologist or another medical specialist who can come in and do a presentation to doctors and nurses so that they're aware. A school, we just had a support group call last night with an education attorney. Meet with the school administrators, tell them, my child is going to be in your school starting in August or September, whenever they start school. This is her or his medical condition. She needs medication. She needs somebody, she may need a rescue medication, which is an injection. Someone needs to be trained. If she goes on school trips, has to be a nurse to accompany her, because if there's an accident, somebody gets injured, she is going to need a nurse that can administer this medication, because she can die. You talked about her collapsing. We had, I guess a couple years ago, a college student who felt ill, and our children, I call them our children. My daughter doesn't have CAH, but they're all my children. They know when they're getting sick. When they're old enough, they feel that something is not right. So this college student didn't feel right. He was beginning, the process of having an adrenal crisis. He started to drive home and didn't make it. So the police stopped him because he was driving erratically. And he said, look, I have a medical condition. I have medication. It's in my glove compartment. They took him in because they thought that he was under the influence of something. No, he was having an adrenal crisis. They then take him from the, now the police took his bag that was in his glove compartment, and the mom sent me a picture of it. It was a clear Ziploc bag with the syringe, with the medication, with a letter from the doctor explaining what it was and when he needed it. Took it to the police department. They collapsed in the police department. An ambulance picked him up and transported the bag with him. He went to the hospital, was at death's door when the mom finally got there. And she got there, and this clear Ziploc bag with an injection, with the medication, with the syringe, with the medication, with the letter, was on the table. And the mother said, look at this. This is what my son needs. He will die if he doesn't get this right away. So then, we sent all sorts of letters to, police department, just educating them. So education is key, and parents need to be advocates, and patients, when they're old enough, to need to be their own advocates. Um, and we need to speak up. Parents absolutely have rights to make medical decisions. We tell, just like you did, we tell every parent, because EMS personnel may not be trained, they may not have the medication, give them the shot. I don't care if you give them the shot in the ambulance, in the emergency room, give it to them, and then you deal with the consequences. You're saving your child's life. That's what
Yeah,
you're doing.
that's exactly right. I mean, we have, related to it, we helped advocate in Kansas and Missouri before we moved to North Carolina. And when I was talking with the Missouri State EMS, the head of EMS there, it was actually in county by county in some
Oh,
cases.
and sometimes it's even
And
more regional. Like, for instance, Texas is a
mhm,
complete nightmare. They have 19 EMS regions, and
yeah,
everybody again can make their decisions. The medical director can say, "Okay, we'll adopt protocols." And then some of the other issues is they think they know everything. So
yes,
we have this medication, Solumedrol, which is the same as Solucortef. No, it's not. Solucort patient really has you really have 20 minutes before the patient really deteriorates.
hmm,
Solucortef, which is the medication of choice, will have an effect immediately, and the patient will bounce right back. And I'm sure you've experienced it, that it's like a completely different child once they get the medication in them.
hmm,
The other medication that they traditionally carry on the ambulances takes 2 hours. That may be too late for some.
yeah.
And it's okay if you live in an area where you can get to an emergency room, and even that's a problem, because if they don't know what they're dealing with, it there can be a delay. But what about rural areas? What if somebody's in an accident and they've been on the side of the road for half hour or an hour before help comes?
Right.
Um, so education, education, education. And I tell parents all the time, I don't care if you risk being arrested, you're
Hmm.
saving your child's life. Do whatever you can.
Yeah, we have talked with parents that the ER was not responding. They weren't doing it. They injected their child and and they were escorted out. They weren't arrested, but they were
Yeah,
banned from
yeah.
the hospital with it. Eden has taken Cambria in and has encountered some, at 2 a.m., you never know who you're going to get at the ER desk. But, even RNs that tell them, said, look, she has been told that she is just an uptight, rare disease mom, and she needs to just chill out.
Oh yeah.
Uh, with that. And we were actually, it was amazing. The hospital that happened at, we were sitting on a parent advisory board at the time, and you can guarantee I went to the next meeting, and it just so happened it was the next week. I was still pretty hot when I
Oh,
went in there, and I pretty
you know
much
what?
told
Some
them,
Yeah, and
yeah,
sometimes it's the arrogance too of doctors who think they know what
yeah,
they're doing. Another quick story. We had a mom of a 2-year-old who was in a hospital, and the doctors thought they knew, and she kept calling us and saying, "Look, you need to talk to these doctors, because I'm going to lose my child. He gets worse every day." And he was there for 2 weeks before they finally started. And I said to her, "You threaten with a lawyer that you're going to call the media, whatever you have to do
yeah.
to save your child." And after 2 weeks, the doctor finally said, "Okay, I'm going to, read this information and listen to it." And he finally did. So education is key, whether it's emergency protocols, or it's surgery. We need parents to speak up. So
Mhm.
whether it's legislation to ban surgery, like I just discussed, patients and parents need to speak up. And sometimes they don't want to, because they want to protect their child's privacy or their own privacy, but you're never going to affect change if you remain silent.
That's what I was going to say. You have to get out of your shell. You can't be bashful. And you're like, well, I don't want to impose on them. No, you're not imposing. That's
That's
their job. They chose to go into healthcare to
yep.
help people. That's supposed to be their oath. And I know that we personally, and for parents out there, can Eden has done this. She has taken the kids and taken pizza. And you hit your local EMS stations that are the ones that are going to respond to you in a crisis. And no, that doesn't cover your whole state, but it covers the majority of time
Right. So
that
if
you're in there.
yeah, I mean, whoever's closest to your home, and they can flag her and say, look, this
Yeah,
child, if you get a call, this child has an adrenal insufficiency, is going to need this type of care.
yeah,
Bring him pizza, you bring him donuts, you bring him coffee, and do that on a regular basis so they don't forget. Maybe you do
yeah,
it twice a year. You can try to do the same thing with the hospital. If you have one EMS station near your house, and then the school is a different one, you do both, and you maintain that communication. And the same thing with the school administrators and teachers. Keep reminding them, my child is going to need this sort of care if they get ill or
yeah.
injured.
We did it. I mean, before we moved cross country to North Carolina, we requested a meeting with, it didn't have to be, we wanted to talk to the school nurse and do that. And we've been very fortunate that, like, the school nurses that we have had an opportunity to work with at the kids' schools, all of them have been aware of what AI is
Good.
and the criticalness behind it. They understand the injections. Now, with COVID, Cambria has been home. She's opted for remote learning for a number of reasons,
Right.
because just like you mentioned with the flu, COVID is a bad thing too. I mean, the AI created with it. We're at Duke Health System now, and they have that's one of the first things we did was go in and establish and say, hey, the establishment of care, this is the protocol we'd like to have in your system so that everybody's aware of it. If she were to come in, and they came back, the endocrinologist came back and said, if she were to catch COVID or develop symptoms of COVID, this is how you're going to treat it. This is the protocol
Right.
behind that. So there are some really, really good medical professionals out there. And, I guess my message is to parents, is being a parent, Eden and I would both say the same thing, I think, is that, you got to advocate for your child. You got to stand up. You got to fight for them. And, you don't just sit there and watch them, this happen to them. Do something,
And you have
really.
rights as a parent, and they have
Yeah.
rights as patients or students, if you're talking about school and education. And when you talk about every education, every child has a right to a public education.
Hmm.
And there are laws to protect that. So we urge parents, if they can, and we had this discussion last night again, develop an IEP or a 504 plan, which is more indicated for medical. But
Hmm.
the IEP has more protections. That's for special education. And even if your child doesn't need, special education, for patients with adrenal insufficiency or CAH in particular, or other, they may need extra time for testing. If your child isn't feeling well, maybe they didn't do so well on a test, and then you find out later that, they come home and they have a fever or whatever, their body is in crisis. So they weren't feeling well, and that's why they didn't do that well, but they have a right to redo that test. So whenever possible, we say to parents, put an IEP in place, even if you don't need it. But that is, the school can't change it. You go every year and you have a discussion about it, but they have to follow those protocols. 504, they can change without informing you. So IEP is, has more protections, but you have the message is advocate, and fight for your child or for yourself as an adult patient.
Yeah, absolutely. And another thing that I think is important is that don't wait until they're in high school.
Correct.
Establish, because we had someone tell us that with the IEP, it said establish that there is something going on even when they're in elementary school. Yes, elementary school is more flexible,
And
and
before
maybe
they
there's
start
no things.
preschool.
Exactly. You establish that there is this concern, and then that way there are no surprises when they get to high school. And they said, "Well, you're just making this up because they're not doing well in school now." No,
Right.
they've had this. because they will.
Other, homework is going to be more difficult. Tests are going to be more difficult. So, by the time they get to high school and college, that's too late. You have
Right.
to establish that early on.
And depending on what they have going on in relation to the adrenal insufficiency that happens there, like with Cambria secondary, I mean, there's sometimes she has 3 doctor's appointments a
Other
week.
issues, right? Absolutely.
So she is going to miss class. So you can't always make them, 4 o'clock in the afternoon,
Right.
when she's out of school. So yeah, we totally relate to what you're
And
saying.
the
And
other issue is, just understanding that you have rights and that patient and that children have rights. We had a mom who was on our call yesterday, and I've been talking to her on a regular basis because I'm very aware of her situation. Her daughter's school wants to get rid of the IEP because they say she's too expensive. Her daughter is too expensive. Well, too bad. We understand you have budget, but
yeah,
that is the right, fundamental right of my child.
yeah. So yeah, exactly. As you said, that's too bad. Let me see if there are any other questions here, Dina. I could probably go on and share the stories even with this, but I think that the main thing that you have gotten across here is that your child has rights.
Oh, I can't hear you. Your audio is lost.
Yeah, oops, I'm muted. But your child has rights. Your child has rights in the hospital. Your child has rights in school. Your child has those rights, and you as a parent have a right
And
to
you have,
advocate
yeah,
for them.
and you
So
cannot let anyone take them away because you give
yeah,
them an inch, they'll take a foot. So you have to
exactly.
be an advocate, be forceful. I don't care if they call you a hysterical mom, a crazy mom, whatever you want to call, or a dad. That's your right. That's, as a parent, that's what you do.
Yeah, and I think that I have found in most of the parents, we had a single parents panel the other day. I'd encourage everybody to watch that too. That you get tough skinned. You just don't care.
No,
And once you see your child go through a crisis like that, I really don't care what you think about me. You
right?
know, at the end of the day, I just don't care. My child's still alive, and
That's all that's important, right?
that's all it is. Deanna, there are no more questions. I just want to thank you. This has been fantastic. You sharing these things with us, and obviously cares when Cambria was. When we went to the hospital that first time, we had no idea what was going on, and we came out, and CARES was one of the first foundations that we found, that helped us to navigate our way through a lot of things with our medical, and to figure out what was going on and realize just how exposed we were uh, to especially on the EMS and the ER side of things, uh, that in needing to educate staff about what was going on. And I'll even say this: that at your ER that that you would go to, if they don't have a flag system of some kind, uh, push for it.
Yeah.
Push it that, hey, this child is flagged as a rare disease child, and this is what's wrong, so that when they check them in, there's no pass go. Get them back there, get them
And
hooked up
tell
to
them
an
you're going to
IV.
hold them accountable.
Yeah,
Tell them
and they can do that.
I tell parents all the time, whether it's school or ER, tell them you're going to see them if something happens to your child because you were telling them what your child needs and they're not listening to you. So hold them accountable. You talk about cares, and we were the ones who had CH added to the newborn screening panel. There are a lot of diseases and disorders that are not on that panel yet, and patients are dying just like children are dying just like CH children were dying before before it was on the newborn screening panel, and they were testing for it at birth. There were a lot of children that were lost. So if your child has a medical condition that is they're um, there's not newborn screening for and they're born with it, advocate for it. Advocate for new treatments, get involved, learn, what's out there. We talk to industry a lot, and there are new treatments being developed. And I think it's critical for the patient voice to be part of that process of developing medications. So, I urge people to get involved, participate in clinical trials, or at minimum, learn and be willing to educate people who are developing these treatments, um, about what your needs are, what your life is like, what the patient's journey is like, because that's critical, um, to make sure that the patients are heard, that their needs are met. Because somebody sitting in the lab, unless you're talking to patients or parents, they don't know what they're doing.
That is exactly right. Uh, that they don't. And, thank you so much for sharing. It's great to hear, and the efforts that you're still doing, and the fight that you're fighting for these kids, and not just kids. This is the thing too. You talked about that some of these people don't have this. I mean, the stories that come out too that people don't realize is that this is not something you grow out of.
Never.
This is not something that you just, and I get that question. I got that from family early on when family was still a little bit involved, and they said, well, this is just something that, when they're older, they're not going to have to worry about. And I'm like, oh no, this is
There'll be
something.
other issues, other implications.
Yeah.
Yeah,
This is something for life that they are going to have. So,
right.
Deanna, thank you so much again. It has been such a pleasure.
Pleasure. Thank you.
Uh,
And if there's any way I can help, I'm here.
thank you. This has been tremendous help. The recording will be available. Make sure you get a copy of it.
Okay.
And, thank you for all your work and everything that you've done and the
Oh,
difference.
and thank you and Eden for all you're doing.
Thank you. We'll talk to you soon.
Take care. Bye bye.